Lyme disease is a bacterial infection caused by a spirochete microbe known as borrelia burgdorferi. That is the one that is most often attributed to Lyme disease, although there are other microbes that can cause Lyme disease depending on where you are in the world. Here's a few Lyme disease stats that you may or may not know. First, it is the fastest growing bacterial infection in Europe. Over 30,000 people are diagnosed each year in the United States with Lyme disease, and the actual estimate of people that have Lyme disease is closer to 300,000 people, or 10 times that, just because we don't test everyone and we don't find out who actually has it very easily here in the States, or anywhere for that matter. All 50 states in the United States have had Lyme disease before, and it's not just limited to one geographic region. Lyme disease is most often spread by a black-legged tick or a deer tick, and all that happens is it bites you and it latches on for about 36 hours, and once it reaches that 36-hour mark, it has sent the bacteria into your bloodstream. The bacteria then does a series of things to survive and thrive inside the body, and they feed on things like collagen inside the body so that they can stay alive for a long time, so that they can reproduce, and so that they can eat and survive within the body. Lyme disease has also been shown to be prevalent in small animals like birds and reptiles and mice, as well as deer ticks. Some sources also say that Lyme disease can be transmitted sexually, while other sources say that is not true. So it depends on what you look at, but it may or may not be transmitted sexually as well. The early symptoms of Lyme disease are going to be the Erythema Migrans rash, or also known as the bullseye rash, because it looks like a bullseye. There's a red dot in the middle and then usually a larger circle around that with some white space in between. It looks exactly like a bullseye, and that will be a telltale sign right away to any knowledgeable doctor that you have Lyme disease. So that is a good sign. On top of that, early symptoms include flu-like symptoms, fever, chills, achy muscles and joints, and just basically feeling like you have an aggressive form of the flu. There are also some late-stage symptoms for some people that can lead to joint pain or arthritis. It can affect your neurological system, your ability to think. You'll get brain fog, you'll be chronically fatigued. There can be facial palsy or facial droop, where one side of your face starts to droop down. It can also lead to meningitis, deafness, tingling in the hands and feet, numbness. In some cases, it can lead to cardiomyopathy or inflammation of the heart, causing irregular heartbeats. That actually happened to me. So who should get tested for Lyme disease? Well, if you have any of the symptoms that we previously described, if you have the EM rash, you don't even really need a test, you just have Lyme disease. Now, if you have some unexplained flu-like symptoms that seem rather aggressive, causing really bad chills and muscle aches, seemingly out of nowhere, then you may want to get tested. Also, if you find a tick on yourself and you know it's been there for at least 24 to 36 hours, then you should definitely get tested for Lyme disease. However, it should be noted that in my research I found that the tests are very unreliable and not the best tests out there for finding out if you have Lyme disease, which is very unfortunate because there's not very many ways to find out. That is why so many people, as I said previously, 10 times the amount of people have Lyme disease than are diagnosed with Lyme disease, because it's just not easy to test for. In some cases, some studies showed that there was a 40 to 50% variance in testing, which means it's kind of like the flip of a coin to know if you have Lyme disease or not, which means it's not a very reliable test for getting tested to see if you have Lyme disease. It's really unfortunate because obviously testing would make it much easier to diagnose more people and heal more people so that more people can get back to their quality of life and not suffer these long-term symptoms that some people go through when it comes to chronic Lyme disease. Finally, how can we prevent Lyme disease? Well, first and foremost, if you're going in the woods where these deer ticks are, you're going in heavily high grassed areas or areas where you have to walk through bushes, make sure you cover up your body as best as you can. Some people will even tuck their pants into their socks, which might look silly, but hey, at least they're avoiding the dreaded disease that so many of us have suffered from in the past. You can also use a tick repellent to make sure that that the ticks don't want to bite you in the first place. And it's important to note that if you get bit by a tick, sometimes antibiotic use can actually prevent Lyme disease from occurring, or if it's early stage Lyme disease, antibiotics can actually get rid of the Lyme disease rather quickly. In some cases, antibiotics don't work and there still continue to be symptoms beyond antibiotic therapy, in which case people will resort to other types of methods like herbs, nutrition, and lifestyle changes in order to get their health back. That is what I went through and what many people go through here on this channel. So if you're new here, or if you think you have Lyme disease, or if someone in your family has Lyme disease, hit the subscribe button, because we're constantly posting videos to try and help the Lyme disease community heal and beat Lyme disease as fast as possible. If you have any questions about Lyme disease, post them in the comments below. I love to open up the discussion, allow people to tell their Lyme disease stories, and get some feedback about the videos that I'm posting, as well as about Lyme disease just in general and what people are going through, so that we can spread the message further and help people understand what Lyme disease is, that it exists in the first place, and that we can do things to help heal the body. So hopefully this video helps you out, and I'll see you in the next one. Thanks for watching. Bye-bye.